900,000 people living in America today are affected by ulcerative colitis, a type of inflammatory bowel disease, or IBD. This condition is a result of an overactive immune system response that causes inflammation in the innermost lining of your gastrointestinal tract and the development of tiny open sores or ulcers. IBDs are autoimmune diseases that cause daily pain for 1.3% of people worldwide. Its causes are unknown, but some factors that contribute to ulcerative colitis include genetic, environmental, and overactive immune system factors. Ulcerative colitis is specifically prevalent in males between the ages of 18 to 30 of Eastern and Central European ancestry and has an average hospitalization cost of around $13,412. While affected individuals have a full life expectancy, if diagnosed over the age of 50, mortality is increased significantly. If you have ulcerative colitis, know that you are not alone. Speak to your doctor today if you are like Dana here and have stomach pains that take you away from your plans, whether that be attending school, engaging in physical activities, or just being with your loved ones. Maybe you have tried to avoid eating those greasy foods that you once loved, made sure you always knew where the nearest bathroom was, or even carried a change of clothes with you everywhere you went. If you have been living a life like this, controlled by ulcerative colitis, know that there is a way out. Ask your doctor about caulfix. Caulfix acts in the GI tract as a non-competitive inhibitor to change the shape of the TLR4 receptor so that it cannot bind with ligand lipopolysaccharides. This prevents a cascade of events in the immune system that lead to chronic inflammation of the GI tract. Caulfix has helped many individuals attain long-term relief from ulcerative colitis. Now you can eat dinner with your friends, go out without constant worry, and stop living an interrupted life. Caulfix may lower your ability to fight infection, including TB. Before treatment, get tested for TB. Tell your doctor if you have an infection, experience frequent infections, or have flu-like symptoms. Tell your doctor if you have been to areas where certain fungal infections are common. Do not take Caulfix if you are allergic to Caulfix or any of its ingredients. Caulfix may cause side effects, including liver problems, loss of appetite, headaches, nausea, or fever. Ask your doctor about Caulfix today and start on the road to becoming happy and healthy with a GI tract to match.
Ulcerative colitis is an autoimmune disease in which the gastrointestinal tract loses its ability to distinguish foreign from self-antigens. It is characterized by superficial ulcerations, granularity, friability, and a loss of vascular pattern. Ulcerative colitis is believed to be triggered by bacterial or viral infection coupled with a genetic predisposition. Colitis affects the mucosal layer of the colon. The disease may be present in the rectum, the left side of the colon, or the entire colon. Ulcerative colitis is characterized by various genetic abnormalities that lead to the breakage of the meniscus layer cells and the uptake of more antigens and bacteria. Overly aggressive T-cell activation, toll-like receptors, monocytes, and pro-inflammatory cytokines such as IL-13 and IL-5 are the main drivers of the disease. The activation of the innate and the acquired immune system leads to detrimental inflammation and cell damage in the intestines and the rectum. Toll-like receptors, especially TLR4, play an important role in triggering these inflammatory responses. Normally, TLR4 recognizes gram-negative bacteria and induces an inflammatory response in order to provide protection against invading bacteria. Although the protein has multiple different ligands, such as viral proteins and polysaccharides, it mainly binds to the ligand lipopolysaccharide, or LPS, when in presence of gram-negative bacteria. Activated TLR4 leads to the production of NF-κB and pro-inflammatory cytokines. These are responsible for activating the innate immune system, and they result in the recruitment of natural killer cells, macrophages, dendritic cells, and an upregulation of phagocytosis. However, in individuals with ulcerative colitis, there is an increased expression of TLR4. The upregulation of TLR4 leads to overstimulation of the innate immune system. Overbinding to LPS on gram-negative bacteria causes chronic inflammation, tissue damage, and ulceration. This excessive inflammatory response in patients with ulcerative colitis caused by the increased expression of TLR4 prevents regeneration of the mucosa. Effectively, Caulfix targets TLR4 by acting as a TLR4 signaling inhibitor and stopping the protein's interaction with LPS ligand. Taken orally, Caulfix migrates towards the mucosal layer of the bowel. It stops the protein-ligand interaction by binding to LPS, deforming the active site, and therefore inhibiting the TLR4 from binding. By doing so, Caulfix will limit the recruitment of monocytes and the production of pro-inflammatory cytokines. Therefore, it will reduce cell damage and inflammation. By halting this pro-inflammatory cycle, Caulfix will reduce significantly the symptoms and the long-term effects associated with ulcerative colitis.